Osteopaths are healthcare professionals who practice a system of manual medicine that focuses primarily on the neuromuscular skeletal and fascial systems. The fascial system is the connective tissue system. They assist patients of all ages who are suffering from a range of problems such as back pain, arthritis, and postural problems from working long hours on a computer or from driving. They also work with secondary functional conditions such as constipation and irritable bowel syndrome, and conditions related to anxiety such as migraines and loss of concentration. Babies who suffered birth traumas are also assisted. Osteopaths do a basic clinical diagnosis. This involves a full case history and a physical examination according to the case history. The case history includes questions on medical conditions, medication taken, occupational strains, and any other treatment they may have received in the past. After they have completed the case history, they assess the patient's general posture through a standing observation. The patient is then asked to do some active movements as well as breathing. They look at the overall posture balance. Osteopaths examine the body of a patient by touch in the sequence of treating a patient. They focus on mobilization of the whole body and then work towards zoning in on the problem area. The aim is to create movement ability throughout the whole body and then do physical adjustments where necessary. An important part of the osteopath's work is to educate patients about their overall well-being. Part of the healing process is for patients to understand why they may have a certain condition and what is to be expected over the short term and the long term. Osteopaths coach people back into functionality. Assisting patients involves physical manipulation and more gentle and subtle soft tissue release of an indirect nature. Osteopaths don't cause pain while they work with patients. They create, through their assistance, pressure change within the body. The procedures they use also open the lymphatic system, allowing fluid dispersion in the tissues so that the necessary nutrients can get there. It is important for osteopaths to work on both sides of the body. The pressure between the different components needs to be balanced in order to allow optimal fluid movement to occur, for example, sinus drainage. The aim of their work is to provide improved awareness about the patient's lifestyle and habits that may have caused the condition. Patients can then take ownership and responsibility for their health. Osteopaths give patients practical advice on things such as abdominal breathing, posture, and taking regular breaks to get enough bodily movement through the day. They may give patients specific exercises to do at home. Currently, there are no educational institutions offering a course in osteopathy in South Africa. However, there are several institutions in other countries where you can be educated and trained to become an osteopath. If you want to practice in South Africa, you have to register with the Allied Health Professions Council of South Africa.